Hello, Mr. Nice. Is this Cleo that you brought in today?
It sure is.
Okay, and I have Cleo down as a 8-year-old Staffordshire Terrier mix, female spayed, and she weighs about 54 pounds. Correct?
Yes.
Okay. And she's here today because you've noticed some hair loss. She's very itchy and she's been rubbing against furniture.
Yes.
Okay. And how long have you been noticing that?
About a week.
Okay. And has she been doing anything else abnormal for you?
Nothing too abnormal other than scratching a little more excessively than usual.
Okay. And then, are you giving her any flea and tick or heartworm preventative?
Not usually. She's an
Okay.
indoor dog, so I didn't think it mattered too much.
Okay, sounds good. And then, do you have any other animals in the household?
We do. We have another dog and a cat.
Okay. And have any of them been showing similar symptoms to Cleo?
Not as excessively. I guess they may be itching, but it hasn't been too over the top.
Okay. And then, what are your goals for today's appointment?
Figure out what's going on with her and why she's scratching so much.
Okay. Well, we'll do our best to do a complete physical exam on her and see kind of what's going on with her. And she hasn't had any history of symptoms like this before, correct?
No.
Okay. Did you start her on any new food or a new diet?
Nope, she's been getting her same diet. It's actually a prescription one for joint relief for her. Doctor thought it would be the best for her joints.
Okay, sounds good. Well, I'm going to get started with my physical exam then. I'm going to do a general physical exam, and then I'm going to focus on her skin and her ears a little bit more, because that's a lot of areas where we see dermatologic or skin issues. So I'll just get started by looking at her face. I'm going to check out her mouth quick. She has good teeth. I don't see any redness. There's no discharge on her nose. Both her eyes are clear. No discharge or redness. Just going to test some of her reflexes quick and make sure those are good. I forgot my little pen. I'm just checking right now to make sure that both of her pupils are working and constricting like they should. I'm going to check her ears out, just externally first. Make sure that there's no redness or swelling visible in her ears. And both of those look good. And then I'm going to use an otoscope and kind of like look down into her ears. And I don't see any mites or excess wax buildup or any signs of infection in that ear. Let me do your other one. You're doing so good. And this ear looks good as well. I know. I'm just going to palpate her lymph nodes quick. Both of those feel symmetrical. And good on that. And I'm going to try to listen to her heart and lungs. Her heart sounds good. I'm not hearing any murmurs or arrhythmias. It sounds loud and strong. And her heart rate is right at 80 beats a minute. Listen to her lungs quick in a few different spots, making sure I'm not hearing any crackles or wheezes. Her lungs sound good on that side. And her respiration rate is right around 25 breaths per minute. Good girl. All right, well, I guess since you're sitting on my lap, I will start by doing your skin exam. So what I'm gonna do is I'm gonna focus on her skin and just kind of bring her hair coat back this way to see if I can see some of those black flecks that you were seeing. And I am. And then I am going to just make sure that I'm not seeing any like crusting or any pus or oozing. And it just looks like it's very red, itchy, and kind of inflamed and irritated. Let's check out your paws quick. Her paws look good. I'm not seeing any signs there. Sometimes that can be a spot that dogs will bother if they have environmental allergies. And both the underside and tops of her paws are good. I'm not seeing any inflammation or swelling on them. Check out the back ones as much as I can. Those are good as well. And just feel her joints quick. She's got good range of motion in her joints. Do a quick body condition score. She's probably about a 5 out of 9 and enjoying her scratches. While I have my hands here, I'll just try to palpate her abdomen quick. I would make her stand for this, but she has really bad arthritis and doesn't enjoy slippery floors. But her abdomen is palpating normal. Check out her genital urinary. And that's looking good and normal there as well. I'm just noticing that hair loss on her rear and down her legs. I am seeing the redness that you were noticing. She does seem very itchy, and I am seeing some black flecks. So we'll do some additional diagnostics to figure out exactly what's going on.